how's that all translated now? And thank heavens that some of the, at times, confusing recommendations in the past, where you had to discuss the patient whether they would get only one or two pneumococcal vaccines, the new recommendations for anyone that's 65 and older, or the at-risk populations, of which you've seen those charted out already, get either a single vaccine, that's PCV 20, or 15 and 23. So I think this is something that will just certainly ease discussions. Some of my more motivated patients have already asked if they can get the new vaccine, even though they've had the older ones, and we'll try to address that momentarily. So here is a nice slide, I think, that looks on the left at sort of the menu of conditions that you may consider at increased risk for pneumococcal disease, as well as charts for adults that look at 20 or 15, and you either get the one vaccine, or if you choose 15, you wait about a year to give the pneumococcal polysaccharide vaccine, or if you're really worried, like a cochlear implant, someone that has a CSF leak, you can even follow that up as early as 8 weeks. Now, if you flip that around as someone has gotten only the polysaccharide vaccine, then you would wait a year and you could administer either of the conjugate vaccines. So the rationale for the adults are that we know as people get older, the immune responses wane. So these are ways of using conjugate vaccines in an older population to stimulate more robust and durable immune responses. The thought is here that there could be some cost savings as well as just an overall simplification to prior guidance, which many had found confusing. We do know that they can be co-administered with quadrivalent vaccines. Certainly PCV 13 has been given with a whole host of other vaccines. We don't yet have data on a lot of the others in adult populations, although the primary tetanus, diphtheria, and acellular pertussis vaccine in children has been studied in PCV 13 and can be given. And certainly there's ongoing studies about co-administration with the SARS-CoV-2 vaccines, including booster responses. Now, if we look at children, PCV 13 remains a standard recommendation, and those 4-dose series have not changed with the first vaccine soon after birth, and then intervals. But the update just introduced in September of 2022 was that based on the data for PCV 15 in infants and children, that can be substituted in place of PCV 13 as a primary series. Now, they still will follow, if you got 15, the polysaccharide 23 recommendations for those special groups that may be at risk. Of course, by adding the two serotypes, that may further benefit that population. There's also catch-up provisions that can get a little complicated depending on timing and the completeness of series. What I would strongly recommend for anyone, especially I'd say in the pediatric practices, the CDC has developed this handy web or smartphone app called Pneumorex Vax Advisor. And by answering 4 quick questions, and this works for adults too, you can get an answer that's updated, including the new PCV 15 recommendations that I've found very handy, certainly before the adult simplifications, but I'd say is also helpful instead of looking up chart information in tables to answer your questions. So to summarize where we are, for adults, there's a simplification that you can give either the PCV 20 or PCV 15 followed by the polysaccharide vaccine for people over 65 or adults under 65 with those special conditions. The CDC and the Advisory Committee on Immunization Practices, just as they looked at PCV 13, will be assessing the impact of these changes over time. And then in the pediatric population, PCV 13 can certainly now stand in for 13.